If you've been dealing with sore, tired eyelids for months, maybe even years, and you feel like nothing you do makes any lasting difference, you're not imagining it, and you're not alone. I'm Mr. Dilraj Sahota, consultant ophthalmologist, and in the next few minutes I'll cover what blepharitis actually is, why standard treatments often fall short, and 2 evidence-based treatments that some patients are never offered. Blepharitis is inflammation of the eyelid margin, which is the edge of the eyelid where the eyelashes grow from. I want to say the word chronic plainly, because this is not a condition that simply goes away. And if you've been suffering from this for some time, that is not a failure of your part. It's an unfortunate nature of the disease itself. Research shows that nearly half of patients have had blepharitis and tried things for up to 4 years before they find a treatment that actually works. It has 2 main forms: anterior blepharitis, which affects the lash line itself, often driven by bacterial overgrowth, or by tiny mites called Demodex, which affect the lash follicles. Posterior blepharitis is the more common form, and it involves the Meibomian glands, which are tiny oil-producing glands on the inside of the eyelids, and they produce an oil which helps keep the tear film stable. In short, blepharitis is not one condition. Sometimes you can have both types or one type. Unless you treat the correct type, your symptoms will not improve. The first nugget: tea tree oil for anterior blepharitis that recurs. If your blepharitis keeps returning despite your best efforts for lid hygiene, Demodex mites might be a contributory factor. There's no simple diagnostic test for this, but there's a clinical indicator that's worth knowing about. If you have small cylindrical crusts around the base of each individual lash, not flaky scales, but waxy collars, that pattern is strongly associated with Demodex involvement. Tea tree oil has a well-documented anti-parasitic effect. A 2021 systematic review and meta-analysis of over 1,000 patients confirmed that it significantly reduces the burden of Demodex and helps to improve symptoms. Use a product specifically formulated for use on the eyelids, like a diluted tea tree oil wipe or wash. Undiluted tea tree oil is irritating and must never be applied directly to the eye. If you have sensitive skin or a history of skin allergies, then check with a pharmacist first before you start using the product. For Demodex, intense pulsed light or IPL is also a treatment option which helps to treat the mite. The second nugget: thermal pulsation for posterior blepharitis. For Meibomian gland dysfunction, there is a clinic-based treatment called LipiFlow. This is a thermal pulsation device which simultaneously heats and compresses the eyelids to unblock the glands inside the eyelids. One clinical trial directly compared a 12-minute in-clinic LipiFlow treatment to twice daily hot compresses performed for 3 straight months and found equivalent outcomes for both treatment modalities. For many patients, the honest problem with hot compresses at home is not willingness, it's the consistency, doing it every day, twice a day, long term, when you've got a busy lifestyle. One clinic session removes that variable entirely, and we offer that treatment to our patients in my clinic in Birmingham. One pattern you must not ignore: if alongside your eyelid symptoms you also had a red, painful eye, or your vision starts reducing, that is not simple blepharitis. You must arrange to see your optometrist urgently to get that checked out, or make an appointment with a GP for an ophthalmology referral. Do hot compresses 8 to 10 minutes daily, every day, long term, if you've got posterior blepharitis. Consistency and technique matter just as much as frequency. Add a tea tree oil wipe if your symptoms keep recurring despite standard lid hygiene. Use only products formulated specifically for eyelid use, and check with a pharmacist if you've got a history of skin allergies or sensitive skin before using these. Ask your optometrist or ophthalmologist about LipiFlow treatment with thermal pulsation for Meibomian gland dysfunction if, despite simple measures, your symptoms are not getting better. See your optometrist the same day if your symptoms are not improving and your eye becomes painful, red, and your vision starts declining. Do not wait for a GP appointment. Blepharitis is chronic, but it is manageable. If you have blepharitis and bad symptoms and you get glare or watery eyes when you go outside, then watch this playlist next, which will explain to you what's going on with your eyes.